Glioblastoma is one of the most aggressive and challenging cancer we know. Today I want to show you how the HumanPSD disease mechanism database helps us to understand glioblastoma at a systems biology level, and how this knowledge can reveal new therapeutic opportunities, options, guide personalized therapy, and even train AI system for drug discovery. What makes glioblastoma unique? Glioblastoma, or GBM, is genomically chaotic and extremely heterogeneous. Within a single tumor, we see different clones, different transcriptomic programs, and different metabolic states. Some cells are stem-like, some proliferative, some more differentiated, and all of them actually adapt rapidly to treatment. This diversity, combined with the suppressive immune environment of the brain, explains why GBM remains such a difficult cancer to treat. Even with maximal surgery, radiation, the drug therapy, most tumors reoccur within months. What HumanPSD brings to GBM research? HumanPSD is a manually curated disease mechanism database. It contains more than 400,000 associations across more than 2,000 human diseases. For glioblastoma alone, HumanPSD integrates more than 1,800 biomarkers, around 2,600 mechanistic associations, and more than 800 therapeutic targets, all linked to the glioblastoma. What makes this resource unique is the quality of curation. Every association is extracted from peer-reviewed literature and annotated mechanistically. This allows us not only to list biomarkers but understand their relationships: causal, prognostic, mechanistic, or therapeutic. Core molecular mechanisms in GBM from HumanPSD. In the HumanPSD GBM report, several molecules consistently appear as mechanistic drivers. For instance, EGFR, including EGFRvIII mutations, it activates PI3K AKT-mTOR pathway. M10 loss leads to removal of negative control of AKT, rewiring the whole metabolism. P53 mutations block apoptosis and cell cycle arrest. And finally, FOXM1 drives proliferation, invasion, and stemness. microRNA 21 or microRNA 221-222, they lead to post-translational regulation of, and they are targeting PTEN, P53, and pro-apoptotic genes. Taken together, this creates a network that explains GBM aggressiveness. A hyperactive growth signaling, metabolic shifts, evasion of apoptosis, and stem-like behavior. Drug repurposing using the disease similarity map. One powerful feature of HumanPSD is the disease similarity map. It shows which diseases share mechanistic biomarkers, not based on symptoms but on the underlying molecular logic. GBM shares major hubs such as EGFR, AKT1, PTEN, P53, and FOXM1. And they share this with other cancers. This opens the door to rational drug repurposing. Concrete example 1. EGFR-driven overlap with lung cancer. Lung adenocarcinoma and head and neck cancers share EGFR with downstream PI3K AKT activation with GBM. HumanPSD highlights this overlap, and it suggests that EGFR inhibitors developed for lung cancer, for instance erlotinib or afatinib, they might have value in combination therapies for GBM, especially when paired with AKT or mTOR inhibitors. Example 2. FOXM1 overlap with triple-negative breast cancer. Triple-negative breast cancer and GBM both shows the high FOXM1, high CCNB1, CDK1 signaling, stem-like proliferative programs, and FOXM1 inhibitors and CDK inhibitors developed for breast cancer could be investigated for GBM combinatorics. personalized therapy with HumanPSD. Because HumanPSD classifies biomarkers by type, causal, mechanistic, prognostic, it becomes a powerful tool for personalizing GBM therapy. Example 1. MGMT promoter methylation. HumanPSD includes MGMT methylation as a strong prognostic biomarker. Patients with methylated MGMT generally respond better to temozolomide. Example 2. microRNA profiles. Overexpression of microRNA 21 suppresses PTEN and activates AKT. MicroRNA 221 or 222 blocks apoptotic regulators. This suggests that patients with these microRNA signatures may benefit from regimens that inhibit AKT-mTOR or from microRNA-directed therapies. HumanPSD as a knowledge graph for AI in drug discovery. HumanPSD is not just a biomarker list. It's a fully structured knowledge graph. It contains curated causal links among genes, proteins, pathways, diseases, drugs, and clinical outcomes. This makes it ideal for training AI systems in drug repurposing prediction, biomarker discovery, target identification, therapeutic combination design, disease embedding, and similarity analysis. Let me give a few concrete examples. Example 1. AI learns causal architecture of GBM. HumanPSD captures relationships like EGFR leads to PI3K, leads to AKT, leads to mTOR, or PTEN loss leads to AKT activation. FOXM1 leads to cell cycle regulators. An AI model trained on this can predict that EGFR monotherapies fail without AKT or FOXM1 co-targeting, and this mirrors clinical reality. Example 2. AI discovers cross-disease repurposing clusters. By embedding diseases based on biomarkers, an AI model sees that GBM clusters with lung adenocarcinoma, melanoma, triple-negative breast cancer. These embeddings match known pathway similarities and surface across disease therapy options. AI proposes FOXM1 network inhibitors. HumanPSD provides the FOXM1 module, which consists of CCNB1, FOXM1, PLK1, and MIP-L2. AI can simulate FOXM1 inhibition and propose combinations targets like FOXM1 plus PLK1 dual inhibition, or something different, and this concept supported in literature. HumanPSD becomes the mechanistic backbone for intelligent, biologically grounded AI systems. To summarize, HumanPSD gives an unified, literature-curated map of the molecular mechanisms of glioblastoma. It helps identifying new therapy combinatorics, repurposing drugs from related cancers, personalized treatment based on biomarker signatures, and even train AI systems that reason over causal biology. This kind of integrated knowledge will be essential for the next generation of prediction oncology. By the way, if you would like to analyze your gene expression data from glioblastoma, and to do it using HumanPSD information and the knowledge, you can watch this video, and where I use Genome Enhancer tool, which is based on transfac, transpass, and HumanPSD databases, and it actually reconstructs the molecular mechanism of glioblastoma in a particular patient, and it finds drug targets for that patient and prioritize treatments for that patient. So if you really like to see how HumanPSD can help in personalized therapy, watch this video and also register for our tools and try it yourself.